So we're here today to talk about the Allergen Immunotherapy guidelines. We felt that it was really important that there's good relationships of communication and trust between primary care and specialists for these type of treatments to go ahead. The key messages that we thought from the project was that it's really important to have education and training in primary care. It's really important that you look at stratification of patients and that get the correct diagnosis, and also that you look at service delivery and treatment effectiveness. What were your thoughts, Roy?
Well, actually the same. And when you look at the barriers, we found one of the barriers was cooperation between specialists and primary care physicians. Other barriers are not so easy to tackle, for instance, reimbursement and issues at the policy level. But for instance, knowledge, awareness, education, these are areas you can work on in your own environment, but also at the level of your organizations.
So we'd like to encourage those of you who are both specialists and primary care to work together to look at shared care decision pathways with patients, because we think it's really important that communication is key here. Thank you. Anything else? Sorry.
Well, I can give an example. For instance, and it's just an example, but in my city, we are trying to establish a shared care pathway, starting with immunotherapy in the hospitals and then handing over to GPs. And we introduced algorithms for decision making, training for carrying out immunotherapy, and also we share medical information, and we obtain medical information from patients about the efficacy and about adherence. And this is just an example, but we hope that it will work.
I think that's a great example. Thank you, Roy. And when I say primary care, I do mean also that we're talking about pharmacists, practice nurses, health visitors, a whole community team working alongside our colleagues and specialists. Thank you.